Hello, everyone, and welcome to today's coronavirus update. The other day we were talking about spring, and I'm looking out the window and it's snowing. So, without further delay, Dr. Diliello, shall we get into the first question?
Yeah, we'll get right into it. So, the first question I have is there any truth to pets transmitting the coronavirus to humans? So, it's a good question. There is no truth to this. And I think it's important to stress because you hear of some horrible stories of people that are abandoning their pets because they're worried that it's going to give them coronavirus. And there hasn't been any documented cases of pets transmitting the virus to humans. You may have heard the interesting story of the tiger at the Bronx Zoo that got the coronavirus. And cats do get their own types of coronaviruses. The evidence is very, very slight and still no evidence that they could transmit it to humans. And, I know some of you may be asking, well, didn't we get this from animals in the first place? And in those instances, it was because people were eating those animals, right? So you shouldn't be worried about your pet.
I have a question over here. Should future doctor appointments be rescheduled? So, as a general rule, the answer would be yes. Non-urgent doctor appointments should be rescheduled. At this point in the pandemic, the risk outweighs the benefits of non-urgent appointments. Now, having said that, to our patients, we're here for you. You can call us at any time. We'll triage the call. If we feel that it's something that requires the emergency room, we'll direct you and advise you accordingly. If we think that it's something we can safely handle at home, we'll do it over the phone and tell you likewise. And if it's something in between, we're going to ask you to come in here and we'll take care of that. So to all our patients, for the long weekend, we are here this year. We're here Friday and Monday. We're available.
Perfect. Another question that I got. So when I wear gloves to a store and I'm on my way home, do I dispose of them before I open the car door? So this is a really good question, and it's because it's so unnatural for us to be doing this, to be wearing masks, to be wearing gloves as we're going out. So as I mentioned earlier in the videos, it's good to get into a routine. So I'll just go through my routine that I have. So in the car, I keep hand sanitizer and disposable wipes, and I keep a little bag on the side, which I use as a garbage. So you get in your car with the sanitizing wipes. I wipe down the steering wheel, the seat belt, the door handles, and all the kind of buttons. And then you dispose of that. Then I use the hand sanitizer for my hands and put on a clean pair of gloves. So now everything's kind of sanitized. Then you could go to the store with those gloves, be in contact with other things. And then finally, when you get to the car, so I get into the car with the gloves, but I make sure not to touch anything, carefully remove the gloves and dispose them, and use hand sanitizer again, just to keep the process sterile. It's important to note there's been a lot of evidence, I've seen it, I know you've seen it, of gloves just being disposed of on the street. So, and that's terrible for our environment. So I really, it would be a good idea to keep a small little garbage inside the car.
That's a great strategy.
Yeah.
I have one here which we've gotten many variations on this theme. My question is that my elderly mother lives alone in an apartment building. We're trying to visit her as often as we can, but the social isolation is getting to her. Should I risk taking her down the elevator and out for a walk? And if so, how often? Also, could she eventually get together with some of her other friends who are also socially isolated? So a good question. The short answer is no. The longer answer is an elevator is of course an enclosed space. Many people are sharing the buttons, so we don't want to increase the risk unnecessarily. You may have seen the statistics, the latest statistics from Quebec are 90% of the deaths are occurring in people over the age of 70. So we really need to safeguard that age group. And sure enough, it's a small risk, but a small risk of death.
Yeah, exactly. And yesterday we spoke about the sequelae of being in isolation, the mental health sequelae. And we understand that human contact is vital, but we really encourage everyone, our patients, their family, just pick up the phone, call your loved one, FaceTime, go to the window, write a letter, anything, but really try to avoid that physical contact. And on another note, I'm hearing it from family members, from friends, that they're bored. You know, the B word. I really don't like that word. And really, this is because people are dying alone. There are people that are separated from their families, and so I empathize with everyone, but also clarify that you won't die of boredom, but you could die of this virus.
True. And so let's go next to our mental health minute for today.
Sure.
So today we thought we'll talk about deep breathing, or we like the term calm breathing actually, kind of like that one. So there's various strategies for decreasing the stress in your life: deep breathing, meditation, yoga. We believe that deep breathing probably gives you the biggest bang for your buck, the easiest thing to learn, and tremendous benefits. The idea is, these days we don't talk about eliminating your stress or even reducing your stress, but rather protecting you from the stress. And taking the edge off of it. Now, there's infinite variations on this technique. One of the ones that we like is in through the nose, out through the mouth. And you could be 4 seconds in and exhale slowly, 8 seconds out. It could be 3 seconds in, 6 seconds exhaling out slowly through the mouth. So many variations. So don't get hung up on any one particular technique. And we like to teach this first lying flat on the floor. I think that's the best way to learn what we call diaphragmatic breathing. So you lie flat on the floor, take one finger, put it on your belly button, and take a big breath in through your nose like we said, and your finger should rise towards the ceiling. And if you're doing it correctly, when you exhale, your fingers should be going down towards the ground. It's not a natural way to breathe, and it's not the commonest way to breathe, and it does need practice and focus and concentration. That's the best way to learn it. Then you can advance to sitting. Many people are comfortable doing it sitting. And then the most advanced way is actually walking. So then you could do it while you're walking, while you're in a conversation, and you have a lot of flexibility. We think you should be doing this at least 5 minutes twice a day, right after getting up and just before you go to bed. And for those of you working from home now, for the first time in your lives, you might actually have that extra 5 minutes in the morning and the extra 5 minutes at night to actually participate in this technique. So like we said, we're not talking about reducing stress here. We're in the middle of a pandemic, and we believe life goes from actually crisis to crisis. So we're talking about trying to protect you from the stress. You don't need to be feeling anxious to do this. You should actually be practicing this when you're calm and get really good at that. And it's another technique like we talk about anything else: exercise, watching your weight, eating healthy. And this is another very powerful stress reduction technique.
Yeah, it works very well. So we wish everyone to stay safe and best of health.